Hello, everyone. Good evening. Welcome to tonight's town hall meeting. I'm Anna Cunningham, and I'm from the local Wake Consumer and Family Advisory Committee, also known as CFAC. First, just a quick word about our Consumer Family Advisory Committee, CFAC. We are a group of people served by Alliance Health and their family members who serve as advisors to Alliance leadership and its board of directors. We help to identify service gaps and underserved populations, making recommendations about the array of services managed by Alliance Health, and reviewing and commenting on the annual budget. If you want to learn more about your local area CFAC, you can reach out to Ramona Branch at our branch at alliancehealthplan.org. You can also find more information on our website too, at alliancehealthplan.org. Tonight, we are grateful to Alliance for the opportunity to co-host tonight's event and for the strong working relationship that Alliance has with the CFAC Steering Committee and our local CFAC groups. We have enjoyed this for years. They care very much about the opinions and the ideas that come from our groups. Alliance is an organization that places a huge amount of value in the insights and perspectives of people who have lived experience with behavioral illness and disabilities. They have many staff members who have lived experience or are family advocates themselves, and they truly listen to what our CFACS members have to say. We know that our input matters, as well as the input of our community at large, and that's why we're here tonight. We want to hear from you. We are in the middle of perhaps the most significant evolution in the history of our state's public health care system, and it's great to have our Alliance colleagues here to tell us more about and to answer questions about the new tailored plan and the tailored care management. So thanks to you all for being here. And now I'm going to turn the meeting over to Rob. Thank you so much. Have a great.
Thank you, Anna, and good evening, everyone. Thank you so much for joining our virtual town hall meeting this evening. I think you know that the Department of Health and Human Services, they delayed the full launch of the Taylor Plan until April 1st of 2023. One of the other things that came with the delay is that tailored care management will begin on December 1st of this year, so within a couple weeks. So given the significance of these changes and the expectations around tailored care management, we did want to hear from you. We want to talk a little bit about the change and then hear from you, your feedback and your questions about this. We have several team members on hand who will be responding to your question. For the sake of time, I'm going to hold off on doing introductions right now. And just before the team speaks, they will tell you their name and their title. So to start, though, we do have a short presentation that members of our team will go through. The presentation is tend to be an overview of the Taylor Plan with a focus on eligibility, provider network development, care management, and some of our efforts to educate and outreach to the community. And then after the presentation, we will have a Q&A, right? So we would like to spend the majority of this time hearing from you about your questions and your feedback around this change. So I was asked to do a little bit of housekeeping, go through the housekeeping rules. To submit a question, please click the chat icon at the top of the Teams window, and you can submit there. We have teams that will be monitoring that. We won't be answering any questions until after the presentation. We're going to try and do as many as we possibly can. If we don't get to your question, we will post those. We will review them and post the answers to it on the Alliance website. So for those interested, to enable closed captioning, choose More and then scroll down to turn on live captioning. All right, so I'm going to get started with just an overview. Next slide, please. All right, I think you all know who we are, Alliance Health. So we are one of 6 LME MCOs and soon to be Taylor Plan. We serve 6 counties: Orange, Durham, Wake, Johnston, Cumberland, and Mecklenburg County. We are primarily serve the urban setting, as you know. While while we had the fewest counties, we are the largest by population. So to be clear, we are not a service provider. We are the manager of the system. We contract with a few thousand providers who actually deliver the care. Our responsibility is to set up the network, contract with providers, monitor providers, provide care coordination, and also make sure providers are paid, right? So that's who Alliance is. Now, let me go into, and Anna touched a little bit about Medicaid transformation. And I know it can be complicated. I'm going to see if I can simplify this as easy as I can. So Medicaid transformation is really about bringing managed care to the Medicaid population. As of up until when the standard plan started, the only managed care was through the LME MCOs. This is the state now wants to bring managed care to just about all of the Medicaid population. There are two parts to the state's plan. The first is development of the standard plans, and they went live over a year ago. In our catchment area, there are 5 standard plans. They are responsible for the physical health, the behavioral health, and pharmacy management services for about 85% of the Medicaid population. The other type of plan, Plan B, is the Taylor plan, right? And that's most of interest to us. We are responsible for serving people with severe mental health, substance use, and just about everybody with intellectual and developmental disability, and those with a traumatic brain injury. So the couple of big differences between the standard plan and Taylor plan: standard plans are responsible for people with mild to moderate mental health and substance use. And I usually define mild as people who are not receiving mental health or substance abuse treatment, or just receiving basic outpatient. And then, of course, as I said, we're responsible for those with severe mental health and substance use disorders, and then everybody with a intellectual and developmental disability or a TBI. The other big difference is we have a more enhanced service array. There are things, enhanced community services, some different type of residential services that are only available under the Taylor plan. And also within the Taylor plan are services for people with intellectual and developmental disabilities. So I want to make sure that that's clear. If there is a chance for you to opt out of the Taylor plan and go to the standard plan, that is certainly your choice. But I want to make sure that people are aware that the services you are receiving under the Taylor plan may not be available under the standard plan. So make sure that you check that. All right, that's the easiest way I can describe managed care. Hope that helps. And now I'm going to turn it over to Sarah Wilson, who is going to talk a little bit more in detail about eligibility.
Thank you, Rob. Good evening. As Rob said, my name is Sarah Wilson. I'm Chief of Staff for Alliance. And as Rob also said, we understand that Medicaid transformation can be confusing. You may have received notices that tell you about certain things based on your population category and what that means for you. So we want to talk to you a little bit about this evening and hopefully clarify some of that for you. So as we move forward, there are really kind of 3 different sections or populations, and where someone falls in this population kind of determines how services will be covered for them. We have our Taylor plan population, our non-Medicaid or our state-funded population, and then our Medicaid direct population. And we'll break those down in the next couple of slides. So first is our Taylor plan population. And as Rob shared in terms of the Taylor plan eligibility, this really is the plan, and what makes people eligible is for individuals that have those more significant behavioral health conditions or a substance use disorder, also individuals that have an intellectual and developmental disability or a traumatic brain injury, and then also individuals who are receiving our non-Medicaid or our state-funded services are also being identified as Taylor plan eligible. And we'll talk in the next slide how services are covered for those folks because it is a little bit different. But for individuals who have Medicaid and that have been identified as being Tailored Plan eligible, Alliance will cover services in the following way under the Tailored Plan. We will continue to cover enhanced behavioral health services and that IDD services, which also includes individuals on the innovations waiver, traumatic brain injury services, and that also includes individuals who are participating in the traumatic brain injury waiver with Alliance. The three services you see highlighted at the bottom of your slide, they're highlighted to indicate that these are the services that will be new in terms of Alliance covering those services when we go live with the Tailored Plan on April 1st. And that is physical health services. There's a new service, Tailored Care Management, which you're going to hear a lot about this evening because it's going to be going live in just a couple of weeks on December 1st. And then also new in terms of Alliance covering that will be pharmacy benefits. So the medications that the individuals that we're responsible for are taking will be covered by Alliance moving forward. Next slide. The non-Medicaid or the state-funded population, as part of this Medicaid transformation, not a lot changes for individuals who do not have Medicaid. Alliance will still be responsible for covering the behavioral health, intellectual developmental disability, traumatic brain injury, or substance use service needs of this population, as long as they meet eligibility for the service, clinical eligibility for the service. But just like in today's system, there's no corresponding funding stream. So we're not getting any additional money to cover physical health and pharmacy. That is not part of what Alliance will cover for non-Medicaid individuals moving forward, just as we don't cover that today. But one thing that is going to be new for the non-Medicaid population is that some of those individuals will be eligible to receive some short-term case management. And that case management can help do things like bridge gaps and transitions of care if someone needs assistance transitioning from a hospital into provider-based care. Some of those short-term case management support will be available as we move forward. Next slide. Medicaid direct population, I think this is maybe the population that is the most confusing, just because I think it's a little bit of a new term that maybe people are not as familiar with. And this is essentially the population of individuals that are either they're delayed or they're exempt or they're excluded, meaning they cannot participate or be fully enrolled with Alliance under our managed care tailored plan. Our biggest populations that account for this are individuals who are duly enrolled, so individuals that have access to both Medicaid and Medicare. This does not apply to individuals who are on the innovations or the traumatic brain injury waiver. As we've stated previously, they are fully enrolled with us in the tailored plan. The other big population that makes up the Medicaid direct group are individuals that are enrolled in foster care Medicaid. And so think of this as kind of separate work in terms of how we work with our Medicaid direct population versus how we work with our tailored plan population. In terms of how services are covered for our Medicaid direct individuals, really the system, the service system looks the most similar to how it is today for these individuals. So Alliance will still be responsible for the behavioral health, IDD, TBI, and substance use service needs of this population, just as we are today. And just as it is currently happening today, physical health and pharmacy for the Medicaid direct population will not come through Alliance, but it will stay through North Carolina Medicaid Direct, which is essentially how this category of individuals received the Medicaid Direct name. So the doctors and the pharmacists that are seeing these individuals, they will continue to directly submit claims for reimbursement to North Carolina Medicaid Direct. On the behavioral health side, those services will be billed to Alliance, and we will still continue to authorize and reimburse for those services. And then also, just like with our tailored plan folks, and I know this gets a little bit confusing because this is the Medicaid direct population, but some of those individuals will be eligible to receive tailored care management. And we'll talk a little bit about what that looks like in some subsequent slides. Next slide, please. So we thought it would be helpful to include for you all a timeline on basically what's happened most recently and what to expect next and Medicaid transformation. So around the end of October or maybe the early part of November, you may have received a notification if you had received a letter previously saying you were going to be enrolled in the tailored plan. And around the end of October, or early November, you received a letter that said the tailored plan has been delayed till April 1st, but tailored care management is still going to be going live on 12/1. So that's probably the most recent letter you received if you are tailored plan eligible. The next letter, you're going to be getting another letter sometime maybe starting in late November. You're going to be receiving a notice regarding tailored care management. It will talk to you about who you've been assigned to receive tailored care management. And it will also explain what your options are if you would like to make a different choice of who's going to be providing your tailored care management for those that are eligible. And then on December 1st, as we've stated, tailored care management launches. So that's just a few weeks away. And then in January, you'll receive another round of letters will be going out to Medicaid beneficiaries. So you'll be receiving another letter that says either you're eligible for the tailored plan or you're going to be eligible for Medicaid Direct, and it'll tell you what your options are. And in the next slide, Sean's going to tell you a little bit more about that. And then open enrollment starts again for the choice period, if you will, opens again middle of January through about the middle of February. And this is for individuals to make the selection of who they would like to have as their primary care provider. And then on April 1st, Tailored Plan and Medicaid Direct fully launch. So I'm going to stop there and I'm going to hand it over to Sean Schreiber, our Chief Operations Officer, to take you through this in a little bit more detail.
Great. Thank you, Sarah, and good evening again. My name is Sean Schreiber. I'm Chief Operating Officer at Alliance, and I'll talk a little bit how you'll know if you're eligible for the Tailored Plan and just some important things to keep in mind. So as Sarah said, in January, you're going to receive a letter saying that you're enrolled in the Tailored Plan or you'll be given the option to enroll. So basically, the Tailored Plan is set up to serve individuals with, as Sarah said and Rob, who may be served on the NC Innovations waiver, who are served on the Alliance Traumatic Brain Injury waiver, and it's designed for people who have significant behavioral health needs and needs for substance use disorder treatment. So individuals who fall into those categories will be automatically enrolled in the tailored plan, and then you will receive, or your loved one will receive, a letter that tells you about that enrollment. One thing that's really important to note, and you'll hear a little bit more about this, there are some services that are only available to you as a member of the tailored plan. And I think the most important takeaway to hear this evening is if you're a member on the NC Innovations waiver or have a loved one on the Innovations waiver, if you elect to leave the tailored plan, you lose that Innovations waiver slot. So it's very important when you just understand that if you choose to opt out of the tailored plan, which you can, but there is a loss of certain services, and obviously probably the most significant would be those for Innovations. Again, when you receive this letter, it will provide a brief description of the benefits available to you. So we'll talk about the transportation benefit that's available to you through Alliance Health, pharmacy benefits, and we'll also list some important numbers so you'll know how to reach our customer service line, how to get in touch with our behavioral health crisis line if you're experiencing a behavioral health crisis, and we also will have a nurse line, so you'll be able to call if you have some medical questions as well. So all that information will be detailed. Additionally, you'll be given an option at that time to select a primary care provider. Alliance has worked very hard to make sure that the providers who have provided services to individuals in the Medicaid program are part of our contracted network. So at the time of you receive this letter, you'll be able to go on to our website and be able to look at our web search tool to determine if your primary care provider is in our network. And also you can always call our 1-800 member service line, and they'll be able to assist you with any issues you may have and help you select a primary care provider. So next slide. So again, the best way to check not just for primary care, but any healthcare provider that you're used to seeing to make sure they'll be covered by Alliance is go to our search tool on the Alliance website. The Medicaid Enrollment Broker website also has a provider search tool, which you can scroll through and find the providers that you're used to seeing. Again, if for some reason you just don't like using web search tools, or if you're having questions or find it confusing, please do not hesitate to call our member services line. at this end of the presentation. We'll leave that on the screen for a while so you have that number. Our member services are there to answer those kind of questions and help make sure you get set up with the providers you need. And if for some case that we've been unable to contract with a provider to join our health network that you've seen in the past, we'll do two things. We'll record your choice. We'll reach out to that provider to see if they're willing to join our network. And if not, we'll also explain to you how you can access the providers you're used to seeing on something called an out-of-network basis, which means you continue to see your provider. Alliance will go ahead and pay for the services to those providers, but they just won't be a contracted provider within our network. And with that, I'd like to turn it over to our Chief Medical Officer, Dr. Jamila Melton, to give a review of our clinical care approach.
Thank you, Sean, and good evening, everyone. Thank you again for joining us today. My name is Dr. Jamila Melton, and I'm the Deputy Chief Medical Officer here at Alliance, and I wanted to give you an overview of our clinical care approach. As we move into this new era, we are taking a more comprehensive care approach. Alliance has a long history of working diligently to provide our members with the community-based services that they need to achieve their health goals. And in continuing with that tradition, we are expanding our approach to the services and care that we provide. Alliance is moving towards whole person care, and we will offer enhanced services that include both behavioral health and physical health benefits. So what that means is that in terms of enhanced services and care management, beginning in December, when our most vulnerable members call in to ask for questions about their care, we will work towards addressing questions about both your physical health and your behavioral health. We will also work to help coordinate care with primary care physicians, specialists, or other providers that you may need to see. And then next April, when we fully launch completely all of our health services and benefit plan management, when you go to see either your psychiatrist, your primary care physician, or your specialist, and that could be your endocrinologist that you see for your diabetes, your cardiologist that you see for blood pressure control, all of those clinicians will be covered under your new benefit plan with us. And then lastly, we're focusing on more community partnerships. To ensure that this happens, we will be partnering with many local companies to provide services. These partnerships will include many of the physicians that you currently see and new partners who can help you obtain eye care, medical supplies and equipment, and specialty procedures. And to tell you more about the care management approach that we will be taking, I'll turn it over to Angel Felton Edwards, our SVP of Population Health and Care Management.
Thank you, Dr. Melton. Thank you, everyone, for joining this evening. My name is Angel Felton Edwards, and I'm the Senior Vice President of Care Management. I'd like to talk a little bit about tailored care management, which is a specialized care management model that's targeted to individuals with behavioral health conditions, substance use disorders, and developmental delayed or TBI. Tailored plan care management is the primary care management model for members who meet the clinical eligibility for tailored plans. You've heard our COO talk a little bit about that eligibility earlier. Members receiving tailored care management can be in Medicaid Direct or a tailored plan. Members are not required to accept tailored plan care management. That means you have the option to opt out of those services. With our new model, tailored care plan management, you will have and be assigned a single care manager who will be responsible for coordinating all of your services and supports. People who begin tailored care management on December 1st will automatically stay in tailored plan case management on April 1st, 2023, even if they move to a tailored plan on that date. I want to talk a little bit about the three types of tailored care management. The first type is what's called the AMH, Advanced Medical Home. And this is basically a large primary care practice who is qualified to provide high quality care management services. The second is a care management agency, also known as a CMA. And the last entity is us, Alliance Health, which is LME-based care management services. I want to talk about the interdisciplinary team and how that will affect you as a member. So as you can see in the diagram, the members in the middle. Primary care manager will be assigned to each member who will be receiving tailored plan care management services. You will also be working with a care worker, a community health worker, pharmacist, a nurse, and maybe other members of the interdisciplinary team to help support you and coordinate your care services. What can you expect when care management begins? You can expect your care manager and other members of the disciplinary team that just showed you on the screen. They will reach out to you within the first 90 days at 12/1. They will also be scheduling visits in person and phone calls to speak with you each month. Now, the number of contacts may be different for each member based on your needs and also is determined by our partners at the state. You and the care manager will partner and complete a detailed assessment. That assessment is called a Care Management Comprehensive Assessment, also called a CMCA. That assessment can be completed in person with your primary care manager, by telephone, or through two-way real-time video and audio conference. During that time, the care manager will ask a series of questions. This assessment can be pretty lengthy, but it is built that way to make sure that we assess and capture all of your healthcare needs so that we can work with you to make sure we coordinate your appropriate care and also provide you with the appropriate support and services. That assessment will generate a plan, which we will also reevaluate each year and update. And also, the care management assessment will be reevaluated each time there is a significant event in your life, such as after a crisis, justice system involvement, maybe a hospitalization, or any life-changing event, and even a pregnancy. As stated, that assessment will help your care manager identify what areas you need assistance with. Your care manager will review these areas and help you decide which one you would like support on first. Once you are happy with the plan of care, then the care manager will share that with you and members of your health team, such as your physicians. This is what your team will follow to make sure all of your needs are being met. I will now turn it over to Ann Osher to discuss community engagement. Thank you.
Good evening again, everybody. I'm Ann Oshel, Senior Vice President of Community Health and Wellbeing. And we know this is a lot of information. It's a lot of changes. You're getting a lot of letters. And our primary goal between now and December, and then again between December and April, is to make sure that everyone that we serve, their family and their loved ones, understand the changes and have all the information that they need to make good decisions on their options and their benefits. And so I want to talk for just a minute about some of the things that we're doing where you can reach out and get some help. The first thing that I want to talk about is our member inclusion and outreach specialists. Some of you may have already met your member inclusion outreach specialists. We have at least one in every county that we serve. Their job is to help connect our members to the services and systems and supports that they need and that they want. They're out in the community all the time and are there to help with the enrollment broker, to help with the ombudsman. There's many layers of making sure that people get to the right place to get the right information. And our member inclusion and outreach specialists can be there to help guide you through that process. The next thing that we are doing is our stakeholder engagement groups. We have 4 of those that are either currently meeting or will be in process here in the next little bit. You already heard from Anna around our Consumer and Family Advisory Committee. This is an incredibly important committee at Alliance. We have both local chapters and we have a regional steering committee that advise us on what is happening out there in terms of our members receiving services. What are the things that are most important? They help inform us around our budgets and financial priorities. So if you are interested in joining any of our local CFACs, please either see Anna or we can connect you to the local CFAC chair. The 3 other groups that we have that we would also love to have some participation is our Long-Term Services and Supports Committee. These meet at least quarterly. It's very focused on our member experience of home and community-based services, as well as some of our institutional placements. And then the other 2 are innovation and traumatic brain injury, TBI, waiver groups. And again, if you would like to participate or have any more information about what each of these groups entails, please reach out and we will connect you to the member inclusion and outreach specialist. You will also, as you've heard, be getting a member welcome packet. These won't go out until late February, early March, after the enrollment period has closed. Please open your welcome packet. There's a letter from Alliance. This might be the first time that you've directly heard from Alliance. It will have your Medicaid ID card. It will have all of the phone numbers. If you have questions about your primary care, your care manager, anything that you need to know will be in the welcome packet. You will also, in that packet, receive a member handbook, and this will be both in English and Spanish. If you have another preferred language or need a large print edition or audio, you can call our call center and we are happy to send out any of that information in your preference. The next thing is our member education efforts. And if you look on our website, there'll be a web page under Community Health and Wellbeing that has a calendar of all of our trainings. This is probably one of the most exciting things that we are doing and really reflects our commitment to not only help people get connected to the services that they need, but to live their lives and have the best life that they want for themselves. And so we will be offering things on disease prevention. So if you want to control your diabetes, if you want to stop smoking or any other kind of tobacco use, if you want nutrition information, anything related to health education, access to care, mental health first aid, you can find a listing of all the trainings that we offer on our website. And then the last thing is our digital education and engagement. We will soon be launching our member portal. You can have access to that. You can communicate with your care manager. You can look at your lab work, test results, your plan of care through that. And then we also have what we call shared decision-making tools, which is something that you can take with you to any of your doctor appointments. And they are tools to assist you in talking about your medication, your plan for care, what you want, what you'd like to see happen. And next slide, please. And when in doubt, please call us. Our member and recipient services line is open Monday through Saturday from 7 a.m. to 6 p.m. We can answer all of your questions. If we can't answer, we will put you in touch with the right person, but I'm pretty sure we're going to be able to answer all your questions. So please call the member and recipient services, especially as you receive letters, wonder who's in the network, as Sean had mentioned before. And then we will, of course, continue to operate our behavioral health crisis line 24 hours a day, 7 days a week. The member and recipient services line is our current 24/7, the 1-800-510-9132. So that number is has already been pretty familiar to the people that we serve. So we kept that as part of our member and recipient services, but we also will operate a behavioral health crisis line. So I'm going to turn it back to Sarah, who will lead us through some questions that you have.
Great, thank you, Anne. Yeah, so we have had a few questions put into the chat that we're going to answer for you now. So I'll read the question and we'll be calling on my colleagues to come back on and help answer the questions. So Sean, we have a question for you around how does the new plan impact and incorporate prescription services? Do I lose our independent pharmacy? And then also there's a follow-up question. Does someone in Alliance make decisions about what medications my daughter can have Medicaid pay for?
Sure. Thank you, Sarah. Let me do my best to answer that. So Alliance will be responsible for covering prescription medication. So we will pay for the medications that individuals need. Alliance is required to cover all the drugs that the state of Medicaid has traditionally covered. So there's something called a formulary that Medicaid puts out. It's basically a list of all the drugs that North Carolina Medicaid pays for, and we are required to cover all those drugs as part of our benefit plan. You know, at the end of the day, it's always the doctor who makes and our members who make the decision about the medicines they take, but we do pay for the medications that are covered under Medicaid benefit. There are some medications that do require an authorization, and Alliance will review those requests and make those decisions at the point of purchase for these medicines. But again, if you're used to getting medications from the Medicaid program, you should be able to continue getting those. As far as pharmacies, we are contracted with something called a pharmacy benefits manager. They help make sure we're have a network of pharmacists. So they're contracting all the pharmacies that have traditionally served North Carolina Medicaid recipients in our region. And we would anticipate that pharmacy will be in the network. And you should be able to start seeing those in our provider search tool shortly. If there's individual questions about that pharmacy, you can call that member service line. They'll be able to take that question and follow up with you to make sure your pharmacy is under contract and in our network.
Great. Thank you, Sean. And this next question, I believe you'll be able to answer too. The question is, are UNC healthcare providers included? The individual is not able to find their primary care provider in the directory.
Sure. We're just in the middle, we're in the process of finalizing our contract with UNC. So UNC physicians, hospitalists, primary care practices will be in our network. We actually are under a contract now for the care management or tailored care management services that UNC will also be providing to our members. So we have one of the services under contract, and we are wrapping up our contract with UNC, and they will be in our network.
Great, thank you. Do you want to hang out with me for another question? This is around the eligibility. And if someone else wants to jump in, certainly we can do a joint effort on this. But the question is, so will all who are currently receiving Medicaid automatically move to the tailored plan, or will they need to actively make a choice to move to the tailored plan? And if they need to make that choice, is it too late to do that right now? I think this is getting at the eligibility slide you covered.
Sure, so I can start and someone can help me out. So again, if someone meets the different criteria to be into the tailored plan, so one is being on the NC Innovations waiver or a traumatic brain injury waiver, then there's a couple of things that mix a combination of past use of some of the more intensive behavioral health or substance use disorder services, maybe individuals who have had multiple episodes of going to the hospital or emergency department or crisis for behavioral health issues. Those individuals are identified and automatically enrolled in the tailored plan. So they don't have to do anything. They'll be enrolled. They'll have the option to opt out, but they will be enrolled. There are some individuals who are not automatically enrolled in the tailored plan, and the exception list is kind of large to go through. We can provide more member-specific detail if you call us, but there is an option where you can opt in and say you'd like to be in the tailored plan, and there is a review by the state to see if they put you in.
Great, thank you. And this is actually a follow-up to your question, the question about UNC. So we'll go back to that real fast. So in addition to what you just shared about UNC, the question is, does that also apply? Are Duke and Wake Med contracts secured in addition to UNC?
Yes, so Duke hospitals and Duke and contracts with Duke Health System are secure. If you go to our provider search tool, you should be able to find all the Duke primary care physicians and a host of specialists and hospitals. So Duke is complete. At this point, we are still in negotiations with Wake Med. But as of today, WakeMed is not in our network, and we're negotiating to see if we can change that before the go live, April 1st.
Okay. And then just one additional follow-up that's also tied to the hospitals. The question is around Duke specialists and whether or not they're in network. The individual was able to find their primary care provider in the directory, but not all of the specialists that either they or their family member are seeing.
Yeah, so we have Duke contracts for all their health services. So so basically we're contracted with the entire health system and all their affiliated practitioners and clinicians. We'll have to take a look at that to understand why those specialists aren't showing up.
Okay, great. Thank you, Sean. And you're off the hot seat for just a little bit. I'm going to ask Kelly Goodfellow, our Chief Financial Officer, to come on. We've had a question around whether or not there will be drug copays.
Yes, good evening. Again, my name is Kelly Goodfellow, Chief Financial Officer for Alliance. Thank you, Sarah. Real quick, yes, there is a copay. It is a $4 copay for both generic and brand prescriptions.
Thank you. All right. And we also had a question that may be easier for us to respond to in writing in our FAQ that we're posting on the website. But there's a question around where the behavioral health crisis line is posted on the Alliance website. So we will definitely try to get that information out. It's, I think, a little bit hard to describe, but we will be able to provide that information as to where that can be found on the website. The other question, and Sean, this may be for you again, is around if someone was trying to find out where their family member, in this instance, it's someone's son, they're trying to find out where they fall. I'm assuming that's related to their eligibility for a tailored plan. Could they find that out, or would they be able to know that if they contacted the member services number?
So as of today, we would be able to see if your son is eligible to be in the tailored plan. The final eligibility happens closer towards April, or enrollment in the tailored plan, excuse me. So today we could say, yes, it looks like your son's eligible for the tailored plan, and that would be confirmed during that enrollment period when you get that notification in January through the letter.
Great, thank you. We have one question that I am not sure I am tracking, maybe others on the panel. The question is around, are any tailored plan recipients under Community Health Medicaid? You may need that person to type in more of a help on that question. I'm not sure, unless someone else on the panel is able to answer that.
Or if the person is, if the person's willing, you could certainly jump on and tell us your question, make sure we get it right so we can answer it.
I don't know if they're able to come off mute.
No.
There's another question, and this was a follow-up to the question that Kelly answered. Becky, your question around if Medicaid has been fully covering your prescriptions at the pharmacy now, that's a question we will need to take back and get clarification from the state on. So this will be one that we will have some conversations, and we will post that likely on our, we have a frequently asked questions, Medicaid transformation questions on our website. So if you could stay tuned and look there, we will definitely get additional information for that and get that posted there for you. Not seeing any other questions. Oh, we just had one come in. I believe this might be related to tailored care management. That's the perspective I think it might be referring to. And so, Sean, maybe you and Angel might want to tackle this one. This is around how do provider agencies fit into the tailored plan, and what are the responsibilities to the service recipient? And that might be around the tailored care management, different types of provider entities slide.
Sure. So I can start with that. So as Angel had reviewed earlier, providers, behavioral health providers, or primary care providers are eligible to provide care management or tailored care management to our members. To do that, they would have had to gone through a process where the state certified them. So they had to send in kind of an application. The state did an initial review, and then they brought an outside accreditation body in to do a final readiness route to make sure that the members could deliver all the core services that really are supposed to be comprised of under tailored care management. Alliance is responsible to make sure that your tailored care manager is completing that comprehensive assessment, working with you to create a care plan, and addressing your various health needs, making sure that you're able to access your healthcare appointments. If there's barriers related to transportation, they're supposed to help you deal with that. If you have questions about your healthcare, they're supposed to help you get resources to answer those questions and talk to you about other resources available in the community. Again, that could be accessing things such as social supports and any number of behavioral health and physical health services. I'll turn over to Angel to see if there's anything I missed there.
You did great, Sean. I think you covered it.
Thank you.
Okay. So actually, Sean and Angel, you all can arm wrestle who's going to take this one. So the question is, so am I understanding correctly that tailored plan members will have a choice of who provides their tailored care management?
That is correct. Two things just for clarity. One, once you're connected in tailored plan care management with either of the three entities that I described earlier, you have the option to opt out of tailored care management services. The second is you also have the option of wanting to changing your care management entity that you would like to be affiliated with.
Thank you, Angel.
So if you are receiving tailored care management from a CMA agency and you would like to receive tailored plan care management from Alliance, then you have the option to make that request and change.
Thank you, Angel. Appreciate that. There are a couple questions that I believe are related to the slide that I covered with the population, the breakdown in population. So I'll ask myself these questions. So what if someone has Medicare and Medicaid? Yes, those are the dual eligibles that I referenced on the slide that indicated that they would be part of our Medicaid direct population. Unless they are enrolled on the innovations waiver or the traumatic brain injury waiver. And so for individuals who are duly eligible for Medicare and Medicaid, Medicare will still be your primary payer for your physical health services just as they are today. Alliance will cover any behavioral health services. Thank you, Doug. Alliance is still responsible for any of the behavioral health, IDD, traumatic brain injury, or substance use services that your family member may need. But again, your physical health and pharmacy will not fall under Alliance. They will either go through Medicare just as they do today, and then anything that Medicare is not covering, Medicaid would be looked at to pick up as the payer of last resort there. So unless that person is innovations or traumatic brain injury waiver, dual eligible individuals are part of our Medicaid direct population. And the next question that I will respond to is around eligibility for someone with IDD. They're eligible for Medicaid. They are not on they're saying they're not eligible for the registry of unmet needs or the waiver. Can they still be enrolled in a tailored plan? And there are certain IDD diagnoses that the diagnosis alone will qualify someone to be eligible for the tailored plan. And so you would know where your eligibility falls based on the letters that you're going to be receiving. So you would have received a letter a couple months ago notifying you of that. Then you got the letter saying that we're pausing. So you will be getting another round of letters that will tell you your eligibility. But an IDD diagnosis, depending upon what it is, could qualify somebody to be in the tailored plan. It just depends on what the diagnosis is. Okay, so we had a question, Sean, that I think is for you. The question is, Medicaid currently offers gas card assistance to transport my son to his doctor's appointments. Will that service be able to continue?
So Alliance is contracted with a company called Motive Care, who will be arranging transportation. And one of the things they do is arrange for gas reimbursement, gas vouchers, and even travel reimbursement, lodging if a member of ours needs to receive treatment out of the area. So there's a mechanism for both prepaying and for gas reimbursement. I will get more detail if it's an actual gas card or a different system, but there is a way to either get reimbursement or if you need the money before the trip to make that happen. And that will be covered by Alliance. There will be a number when you receive your Medicaid card or your son's Medicaid card that has a number to call to secure transportation or gas reimbursement or a voucher.
Great,
Hey,
thank
Sarah,
you.
I think we missed a question up on 13. I was reading through, sorry, on our list. A question I believe is if a practice offers routine services and does not plan on offering tailored plan specific services, will they still need to contract for the tailored plan if they want to continue to treat the members for those routine services if the member moves to the tailored plan? So one thing I think we probably should have clarified, Alliance will offer all the benefits that the standard plans offer. So we offer all those routine services, but also a set of kind of more specialized enhanced services. So a more routine, say, behavioral health services is individual therapy. That's available to our members as well. So we've built a large network of individuals who actually provide those routine services. But if you were seeing, or your loved one was seeing a provider for, say, a kind of a routine benefit, and that provider elected not to join the tailored plan at first, if you transition to the tailored plan, we would continue to honor and pay that provider on an out-of-network basis while we work to get them a contract to be within the tailored plan. So you shouldn't have to have a disruption of care just because you have the change of insurance.
Great, thank you. And we have a question around opt-out. I believe the opt-out that they're referring to is related to the statements made about you do not have to accept. You can choose whether or not you want to accept tailored care management. And so, yes, somebody can opt out or they could say they want tailored care management and then decide they don't want it really at any time. The open enrollment is really more around the time period in which somebody would be making their selection for primary care provider. So once tailored care management goes live on December 1st, you can opt out at any time from continuing to receive tailored care management. All right, I'm looking. I think we've gotten through most of the questions. I know we have some questions that we we'll be looking into and getting feedback to this group through the FAQ process. Are there any other questions this evening? We are getting a little close to time, but we may have just a few more minutes for a question if there are any other questions. If not, I'm not seeing any come in. Rob, I don't know if you or Anna want to have any last words for the group, but we do definitely appreciate you all joining us this evening and hope you found this informative and helpful.
Yeah, it's great questions. Again, thank you so much for joining us. Again, if you find that you do have additional questions, please call our member and service line. Staff will be available to answer any questions. Anna, you want to take us home?
I'll be happy to. I just want to remind everyone about the opportunity that is offered through the structure of the Consumer Family Advisory Committee. And we welcome any of you to come and join us at any of our meetings. And each catchment area has a local, what's called CFAC, Consumer Family Advisory Committee. And then, of course, we all get together and also have at the steering committee meetings that occur also. So I just want to welcome you all. And if there's anything that we can do to provide more information about how to get involved with us and or to get you connected, just please let us know. Again, Ramona Branch is one who can give you all of the information with regards to each of the local areas. And her email address is rbranch, so R and BRANCH at alliancehealthplan.org. Thank you guys so much. It was great to be able to see you all. And anytime you got questions, we're all here ready to answer. Thank you.
Thank you. Have a good night, everyone.